Drive Home with Stacey and Jay Spoo, East Coast Radio.
This month is a very important month. It is Cancer Prevention Month, and today we are going to get into a conversation about the importance of HPV vaccination in school girls. Now, last year, I recall, the National Department of Health shared that human papillomavirus vaccinations will be conducted at public, special, private, and independent schools by teams of healthcare workers. We were like, yay, that's good. Yes, we want forward momentum when it comes to this. The department has stressed that cervical cancer is highly preventable through HPV vaccinations. They further encourage parents, caregivers, and legal guardians to sign consent forms to ensure that their children do not miss out on this life-saving vaccination.
So all of that is great. We read this, we kind of have a brief understanding, but the issue with, I think, female health in particular, and that's another crisis, is that there isn't a lot of info readily available, right? For example, what even is HPV? So we're going to break it down for you as the hour continues, especially if you are a parent of a young girl child and a woman, actually. So Dr. Angelique Coetzee, she is a South African general practitioner and former chair of the South African Medical Association, has gone into great detail for us about what this viral infection is, and incredibly important. Have a listen.
Dr. Angelique Coetzee. I'm a practitioner, 40 years in private practice, and currently the vice chair of the Unity Forum of Family Practitioners in South Africa. So what exactly is HPV? It's Human Papillomavirus. It is a family of over 200 viruses. And they are divided, this family of over 200 HPV viruses are divided into a low-risk HPV, which normally will present with warts, or a high-risk HPV that might go over to cancer, cervical cancer. And how does one get it? It's transmission. It's skin-to-skin contact, so it's not only intercourse. So let's say I have a blister on my lip and I have oral sex, I can unfortunately also give herpes too, but that's a bit different than HPV, but it's still viruses, I can transmit it. In some cases it can even cause pineal cancer, and then vulvar cancer, and then throat and tonsil cancer, which we see there is a bit of an increase worldwide. So today your HPV throat cancers in men are quite rising, quite faster than your cervical cancer in women in some of the countries. So important, HPV is not only a women's disease. Vaccinate your boys, it's a very good practice to do that. I have done that to the son. I've got two sons, and I've done that many years ago when it came onto the market. HPV is a vaccine that one needs to administer, ideally between 9 and 14 years before exposure, because the immune response in children between 9 and 14 years is very strong, it's longer lasting, and also it requires fewer doses. So the schedule for under 15 years is 2 doses, 6 months apart, and if you administer or inject HPV, because it's an injectable, and you are 15 years and older, it's 3 dosages. First one on the first time, it's month naught, then 2 months later, and then 6 months from the first injectable. And then, yes, adults can also get it up to the age of 54. Also, you can get it later in some cases, it depends on what it is. So please, the once-off opportunity for parents to prevent their children from facing a cancer diagnosis 20 years later. Most of these vaccines prevent the infection, and this one prevents a future life-changing disease. It's not about sexual behavior, it's about giving your child a future where the preventable cancer never has the chance to start.
So that is Dr. Angelique Coetzee, South African general practitioner and former chair of the South African Medical Association, discussing HPV and, more importantly, why vaccination is important. And towards the end of the interview there, she said, it is not about sexual behavior. It's about giving your child the future where preventable cancer never, ever has a chance to start. And this is something that I feel incredibly passionate about, and how I wish I had the opportunity to have had this jab at the age of 9.
Can you tell us more about that, please?
So this is obviously all born out of this massive kind of vaccination station that will be happening across schools, and parents are being encouraged, especially the parents of young girls, to allow their kids to be vaccinated because clearly you would need permission. And there is this misconception around what HPV is, which is why we wanted to shed some light on it today, because it is not an STD, okay? It is skin-to-skin contact. That's why boys also ideally could be vaccinated, because they are the ones who carry it. No symptoms, but for the girls, it can ultimately lead to actual cancer, cervical cancer. And this is something that's important to me because when I was probably, 27, I was living in Johannesburg. I needed to find a new gynecologist. I am a firm believer that we need to be going and seeing our doctors regularly. Dentist, shrink, gynae, you name it, you're going, right? And I tootled in there, and she was lovely, and she ran a whole batch of tests because obviously new doctor, new client. I gave her all my history, and she phoned me back. Her office had called me back a couple of days later, and they said, the doctor needs to talk to you. And I was like, well, that's not good. It's never good when a doctor wants to see you in person. And to cut a very long story short, unbeknownst to me, she had run a test for HPV, which is actually something that isn't traditionally done for women under the age of 30. But because I was a new client, she wanted to kind of get a full screening. And the problem was, it wasn't just that the HPV was present, it's that HPV and how the cells mutate and what it does to that part of your body. At that stage, it was already cancer for me. And if she hadn't run that test, I don't know that I'd be sitting here today. And if I'd had that vaccination when I was younger, that would have never happened. So once again, God is good. That doctor, bless her, did what she needed to do. And that phone call was on the Tuesday, and by Friday, I was in a hospital having emergency surgery. And it's 2026 now. So the end of 2024, did a gynecologist who I've come to see now in KZN since I moved tell me that I'm officially clear. So it's all gone.
Yeah.
But it's something that you stress about and you live with every single day, and you worry about these test results every time you have to go in and get your blood drawn. And it's something that can be avoided. We don't need to be losing goals over something that is completely preventable. So to the parents, we obviously don't live in the dark ages anymore. I think do a little bit of Googling, do a little bit of research, appease yourself, educate yourself, and imagine if it was your daughter who, 20 years down the line found out that she had this, and maybe it's not as easy to remove as it was in my case. Has it left me with scarring? Yes. Has it changed the way that my reproductive system works for the rest of my life? Yes. But at least I'm here, and all of that can be avoided. So do your research, get the vaccination, and protect yourselves, please.
Stacey and Jay Spoo, KZN's #1 hit music station, East Coast Radio.